And Maria, I'm writing your name down right now.
Thank you.
Do you want to let us know, Larry or Randy, when you're ready to go?
We are live and recording right now.
It's your meeting there, Mr. Bjork.
I am ready. Thank you very much. Today is Monday, May 17th. This is a committee meeting for the Dunn County Nutritional Advisory Committee. And call the meeting to order. And how about if we just go around the room and introduce ourselves? I don't know if we have any new members. I've got the agenda for the next meeting, but not this meeting. So I'm Larry Bjork. I'm the chair.
I'm Betty Zimi. I'm a committee member.
Gary Steen, County Board Member.
Dave
Maria
Bartlett,
Bukowski, board member.
Dave Bartlett, County Board Chair.
Lonnie Dodge, the ADRC manager.
Sarah Kennedy, board member and ADRC chairman.
Chris Corpola, Human Services Director.
And Bernie Allen, Nutrition Program Coordinator.
Carol Kadinger, board member.
I think that captures them all.
It does. And I guess we would call for a motion to approve the minutes of was it the March 15th meeting, Chris, I believe?
No, it's January 18th, Larry. We haven't met for a few months.
Okay, January 18th.
I move we approve.
Got a move in seconds?
Yes, I'll second. Betty.
Betty.
Thank you, Betty. The motion's been made and seconded. Any other discussion? Just a voice, all in favor, aye, please, for approval.
Aye.
Aye.
Next item on the agenda that I have is for public comment. Do we have anybody from the public or any notations or correspondence, Chris?
We do not. I didn't include that as an agenda item on this meeting just because this is just the Nutrition Council. So there is a public comment in the next meeting, but the next item on this one is just a review that the next meeting for this group will be September 20th.
Sounds good.
And that's great. I did not get an agenda off the computer, so.
And so then the next item, Larry, is program updates from Bernie.
Well, I'll tell you what, my vast experience, anytime Bernie speaks, it's been good news. So I am happy to hear whatever he has to say. Bernie?
All right. Well, thank you. Yeah, I believe I have good news. Pretty much just updates of what's going on here with the program, of course. First thing I'll mention is program participation. Recently received the numbers for the first quarter of this year. And it's pretty comparable to what I've been reporting recently. Our restaurant sites are kind of still down with participation. But the home delivered meals continues to be kind of the strong point. Colfax, for example, is up over 30% compared to that time frame, last year. And then and Tantera is up 17% compared to last year. And I thought it was an interesting fact when I look back and comparing Menominee to 2019 compared to 2021 this year, it's up over 106%. So it's kind of pretty much doubled in that time frame. So yes, we can even though we aren't currently doing the traditional congregate dining and the restaurant sites are a little down, the meal home delivered is up and busy. So, and the next thing listed as congregate dining, reopening planning. So we've, kind of been working with the state. We've received some guidance, but overall, the decision is going to come down to each county is going to decide what they're going to do for reopening them in-person dining at their congregate sites. Right now, I think actually next week, Shawano County is going to be the first one to kind of start that off. So for the most part, no one has done it yet. There's lots of different information that's kind of flowing around. And now, of course, last week with the change in the CDC guidelines, there'll probably be some more review. I did meet with our Greater Wisconsin Agency on Aging Resources last week, just to talk a little bit more about it. And she's continuing to share information. And then, of course, here in Dunn County, we'll kind of go by, what this group thinks, what the health department thinks, as far as setting those policies and procedures for when we do reopen. So that's kind of where we are with that. But as I mentioned, now that the CDC has indicated that you don't need to wear a mask if you're vaccinated. So we have to kind of revisit, because a lot of the sample documents that have come out were prior to some of those changes. So more to come on that, but I know we are getting closer. We're seeing some of the senior centers reopen. The Menominee Senior Center is planning, I think, June 14th now. Originally it was June 1st, and now they pushed that back a little further, but so hopefully soon. Next up is the Senior Farmers Market Voucher Program. So I'm not sure how many years this program has been offered, but I know last year we did offer it during the pandemic. Traditionally, prior to the pandemic, our participants would come into the ADRC here. They'd fill out a form and sign it, just to agreeing that they follow the certain guidelines, because there's some criteria that they need to basically it's based on age and income. So if you're at a certain income level, you can receive a $25 worth of farmers market vouchers. Last year, all the communication was done over the phone, and then we'd mail out the form to be signed and sent back to us. And this year we'll do the same. They've agreed that would be the best case scenario for 2021. Excuse me. And we have received 106. We will be receiving 106 packets with vouchers to be distributed here in Menominee and in Dunn County. And that is a popular program, and I've already received some phone calls. A lot of the same individuals who have participated in the past know to call around this time to check in and see about getting their vouchers. So we'll be doing that again, and that makes it really easy for everyone, because then they don't have to, be concerned about transportation here and back if they don't have that readily available. And then one of the other topics here is just the satisfaction surveys for the nutrition program. So I think, this year we've been giving out a lot of satisfaction surveys. We're working on the aging plan, but this one is required again by GWAR. And it goes out to the individuals who receive home delivered meals. And then this year, we also offered it we distributed the surveys to people that were picking up their meals, the carry out individuals. And then at some point, we'll also provide this survey to the congregate diners once we reopen that. But we already received 53 back, which I think is pretty good. And they on the bright side, 100% of the participants that or the surveys so far have indicated that they would recommend their program to friends and family. And there was a lot of positive comments about the drivers and the meals as well. So yeah, it's interesting to see what people fill in or write on the survey. But so we continue to receive that, and all that information is collected, and then I report it back to GWAR. They just have a fill-in document that I submit.
When is the timeline for that? Bernie?
Throughout the year. Basically, we just, well, actually, I think it needs to be done by maybe November, but I just wanted to get going on it to get it started. So, and they didn't do it last year. They said, well, let's take a break because of the pandemic. But in years past, they've done it, and individuals can fill it out online. But for the most part, we sent out with statements these surveys last month. So we received many back that way because they already have a prepaid envelope that they're sending back to us anyway. So, yeah. Any questions on any of that information? Gary?
Yeah, and this question could go to Chris or Dave, Lonnie, and you. The congregate dining sites, I'm familiar with Colfax, and I think with the relaxation of the mask mandates and the size of the people that visit our site over here, it seems to me that it'd be a good candidate to reopen in person here as soon as possible. You check with KT and see, and Chris or Dave, you guys have any thoughts on when this might happen, June 1st or what?
I know that Mr. Miller and KT, and I don't know if Chris, if you're involved in that meeting, but they worked out a plan moving ahead last week, and then the CDC changed their recommendations, and they were going to meet again this week and work out some plans for indoors, opening the building maybe. Mr. Miller rattled off a number of things they'd be discussing. This could be one of them. I would guess if they open the buildings, this would also ended up getting opened up. But maybe Chris has something to add.
So, yeah, I think that's exactly correct. We did meet last week extensively to talk about reopening the building, returning people to the, that we're coming back to the workplace, and then that was on Tuesday, and then on Thursday, what we'd worked out was not obsolete because parts of it still are relevant, but it looks like the building will open probably our target date from last week was June 1st. Whether or not we can stick to that, we are at 32.5% today of vaccinated people, and our goal was 33% of the population of Dunn County to be vaccinated. And then, yes, we're working through all of the details regarding when masking is required and when masking is not required. But I did put on here as a discussion about, so going forward, the goal will be to offer people an opportunity of a choice to either appear in person for these meetings or to participate via Zoom. And so we will host meetings in the basement in room 60. So if you've been in the large auditorium-ish kind of room where the county board meetings are held, it's the room next door is room 60, or the room next door is room 60. And so anyone who wished to participate in person would come for that meeting. And then if people still wish to participate virtually, we would have a mechanism of being able to connect to Zoom so that the people who were virtual would be able to see the participants in the conference room, and the conference room participants would be able to hear the people on the Zoom, see and hear the people on the Zoom meeting. So that will be our goal for the next time that this group meets, which would be September 20th, and then for our ADRC advisory committee, which will be in July. Did that answer your question, Gary?
Yeah, I wasn't so concerned about the committees as I was about the congregate eating places.
Oh, I'm sorry. I misunderstood. Oh, yep.
Yeah.
No, I think that Bernie said it. We will work with, I mean, there's a little bit of a reticence on all of the party counties to be the ones who go first, but then usually it's sort of like the kids following the kids, you know, on their bikes. Once one goes, they follow in fairly short order. So I would guess that as soon as someone works out the logistics of what that can look like, there will be much copying, and that will happen on a fairly quick basis. I mean, we do need some time for people to ramp up to make sure that we have adequate volunteers and, you know, all of those pieces are in place. But since they've been farming the meals out for home delivered, it'll also be curious to see how many people come back and what the guidance is around home delivered versus congregate meals. If you will recall, before COVID, in order to receive congregate meals, to meet home delivered meals, you needed to be homebound, or at least have a difficult time getting to the congregate meal sites. And so I don't know if that guidance will revert back to that, or I don't think we know that yet. Correct, Bernie?
Well, I think to some degree it will. You know, as far as the congregate, I know they are going to continue to offer carry out as an option, you know, because typically the carry out was never an option. It was either home delivered or, you know, come and have a meal with other seniors. But they're at least saying that for now they're going to continue with the carry out. And then as far as the congregate, I think, Gary, I agree that Colfax is ideal to get going with that again once we have everything in order because of the amount of space and the ability to spread out. But I just think now we just have to make sure that A, we have approval, and B, we have a process, because even just last week, the one site that was opening in Shawano, they had all these specifics about, well, you have to have a mask on if you're not eating or drinking something. And so, but now with the changes, we just have to kind of determine what our signage is going to be like, what are we going to require of people, and how we're going to go about that. But I think that's coming quickly, hopefully. So, and I've been in contact with Loretta plenty, of course, over there in Colfax, and I know there's a group that would definitely like to get back into some of those normal routines. So that site is a priority for sure.
And I'd just like to, as a participant in the Meals on Wheels, very good food. All the people that delivered to me and my wife, very nice people, very thoughtful, and pass that down the line or up the line or wherever you want to pass it. I think it was a positive experience, and I think I got to have my knee replaced in July, so I'll probably sign up again.
Thank you. Yeah, we'll be there. Just give me a call and get you set up.
Yeah, thank you very much.
Do we have any statistics on the seniors that have been vaccinated? If Dunn County's at 32.5% overall, is that broken down at all by age groups?
It is, but the last time I talked to KT, and this was maybe 2 weeks ago, 68% of people over 65 have been vaccinated in Dunn County. So that's a pretty high percentage, and that was a couple weeks ago, so I imagine it's even higher now.
Thank you.
I have a quick question for Bernie. Hosford Rich, would that also again return to a congregate meal site?
Yes. Yes, at some point they'll come down to the dining room to have their meals again in the future.
Great.
Yeah, so we'd have Hosford Ridge, hopefully O'Galley as well, and then Tantera and Menominee here, and then Colfax. So those would be our congregate sites. And then of course the restaurant sites, I don't know, we have to work on that too, because those have been carried out, and eventually we'll move those into in-person dining as well. Especially now that things are getting less restricted, because those restaurants are challenging because they're so small and there's not really ability to space out whatsoever. But maybe now as things are changing, it'll be easier to get those open again for just having seniors sit down and dine versus carry out.
One question, Bernie, on the vouchers for the farmer's market. 106, does that pretty much cover people that are interested in, or is that snapped up right away? Or is there any way to enlarge that number with the idea that, you're really helping two groups of people at the same time, the people, buying the vegetables and also the growers?
Well, that's a good question, Larry. So WestCap is an organization that manages that program. And they this year, well, last year was the first year I was involved, of course, but this year they said they just broke it down basically by the population in the county, because they send these out to, I think, 5 or 6 neighboring counties. But I think that's about right. I think that's about what we had last year. And the first, 75 go really fast. And then by the end of the season, there was just, there was a few left. So I think it was a pretty good number. And I personally, I kind of wish they would up that number, or the value, I should say, the $25, because it doesn't really go very far, but that's certainly out of my control, but it would be nice if they could get even a little bit more to spend at the farmer's market. So yeah, and as far as the farmers that participate, I believe they all have a little sign or signage indicating that they're part of that program, and then they can take their vouchers and use them just like cash. So, but I think 106 is pretty good, because like I said, there's probably at least 50 or 70 that do it every year, and then they I guess we'll find out this summer how popular it is, but we didn't run out last year, I guess I'm saying. Yeah.
Thank you. Any other questions for Bernie? Well, that was a great report. It's kind of something to be proud of at Dunn County, that we and other counties, doing this. And any experience I've ever had with people talking about it is just exactly what Gary was saying. Good people and pleasant experience. Okay, where do we go next on the agenda? Need a little help.
I think Chris dropped off the meeting here. I don't.
Yeah, we
think
lost
went to the
Chris.
other meeting. The other meeting starts at 1:15, I think, and
Oh.
Yeah.
Okay.
I think you're done, Larry.
Adjourn. Yeah.
Good. Well, I've heard that I've been done a time or two, but I keep coming back.
The other meeting's held in the same room, so I don't know where Chris went.
Yeah. Well, good. Well, listen, thank you everybody for participating, and without any other discussion, we'll call adjournment. And what was the next meeting date? Was that the September 20th?
September 20th.
Yep.
Stay
Hopefully
healthy, everyone. Goodbye.
Here.
Thank
All right.
Thank you. Bye.
So now we just need Chris, huh?
Yeah, our meeting starts at, let's see, I've got the papers right here.
1:15, it said.
1:15, yes. So,
Well, maybe you could start, and Lonnie can take the minutes or whatever.
I will do that. It's call to order. And the thing is, it says introduction of new members, and I don't know who's supposed to be on this committee and who isn't, to tell you the truth. So I don't know what kind of a roll call we can have. Lonnie, do you know? I'm sorry, Lonnie?
Yes, sorry, I was muted. We do have two new members. Heather Jerry is one, and I see she just joined us.
Okay.
And, I can't remember the other person.
Was it Suzanne?
Sherry Homestead.
Oh,
Okay.
Who is that?
No, I'm not
Sherry,
new.
Okay.
I'm the other new one, Sherry Homestead.
Well,
Can you
it's
hear
nice to
me?
meet both of you and welcome to this committee. It's always been a good one, so. The first thing is we will have to approve the minutes from the March 15th meeting. Has everybody had a chance to read it? There are copies sent out with the agenda, so. Are there any additions or corrections?
Also move, Sarah.
Okay, a second?
Second. That's
Okay,
easy.
all in favor?
Aye.
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 Okay. The next thing is public comment, and I don't know if we have any or not.
I thought Chris said there was one, but I don't know.
Yeah. There's someone in our chat room, a Randy Peters. Does anyone? Oh, now he's gone.
Oh,
Oh, the chat disappeared. So, and then the next thing again is the upcoming meeting dates and times, and it's set for July 19th. And I'm assuming at the same time, 1:15. So are there any, I'm sorry, I missed a step here. Were there any public comments? Do you know from anyone?
Well, I thought Chris said that there was one, but I don't know what it was.
Randy, do you know?
I'm looking right now. I don't see any. None that I can tell through that came in through the email anyway.
Okay.
Huh. I wonder where Chris went. Okay, the next item on the agenda is staff reports. And
That
so, excuse me, would that be
Would
you?
be me.
Okay, it says 2020 activities and data presentation.
Yep. Randy, am I able to share my screen?
You should be. Yes, I gave you co-host. So
Okay. So if I just click, can you see what I have on there now?
That's so far.
Not yet.
I cannot as well.
Okay.
Oh, Chris is back now.
Oh, these are the things that make you consider retirement.
Now,
Chris,
can you
can
guys
you-
see my screen?
Yes.
Yes.
Okay.
Yes.
All right, so let me just make sure that we've got who we need to that have popped over here. We get to, oh, yep, Heather's here, good. I think the one that I know, I think Leanne was on her way over.
Well, I know she was gonna be here,
No,
but
she was in the other meeting. That's where I was trying to get people popped over here. So I think her, Margie Hageman. Okay.
Chris, can I have you pass me host again when you get a second?
Oh, absolutely. How did you lose your host?
I lost it when you joined in.
Oh. I so apologize.
So are we ready to go back to Lonnie's report on the data presentation or not?
Give me 1 minute.
Okay, I will do that.
I'm just gonna see if, trying to hope that I can get these guys in this meeting. Okay, I think I've got all the invites correctly out there. Oh, jeepers. Close. One more minute, I promise. 1 minute. Promise. Where is she? Okay, I think that's as good as it's gonna get. I can't, there comes Leanne, so I know those other guys got theirs, so hopefully they can get in with us. I think you can go ahead, Sarah. I'm sorry.
That's all right. Lonnie was just going to give a staff report on the 2020 activities and data presentation.
Okay.
Yeah, I thought I would just kind of pull together some statistics and so we can compare 2020 from 2019 and what we plan on doing in 2021. And this will also help the new members just kind of see what we do to and just kind of get familiar with the ADRC. So our resource center has remained open throughout all of 2020 for phone calls only. We're open Monday through Friday, 8 to 4:30, but we did remain closed for walk-ins. In the past, people could just walk in and get information or pick up brochures or whatever. But since the pandemic, it has been closed, and hopefully we'll be able to open up that pretty soon. Our information and assistance workers, there are 3 social workers, and in 2019, they provided support for 2,504 contacts. And as you can see in 2020, they provided 2,739 contacts, which a little bit higher. So they were pretty busy, even though there was still the pandemic going on. People were still calling us. The main reasons why they call is to get information on long-term care system, abuse and neglect issues, nursing home care, supportive home care services, insurance and income maintenance, and transportation. Those are the 6 top ones. Otherwise, there's a huge host of a list of other ones, but those are the main ones. What those 3 social workers do, they help with long-term care options counseling. They give you information so that you can make choices of where you might want to live or what kind of help you need, how to pay for things. They do one-on-one consultations to help you think through the pros and cons of certain situations or programs. And they help you understand what services are out there. In 2019, there are 228 individuals referred for long-term care eligibility screenings. And of those, 116 were found eligible for Medicaid long-term care services. And those were provided, the provided options were IRIS and family care managed organizations. In 2020, there was 171 referrals and 74 found to be eligible. So the pandemic did affect those numbers somewhat, slightly lower. We have our benefit counseling. The benefit specialists provide information about different government benefits that people can be entitled to, such as Medicare, Medicaid, Social Security, disability, and a whole bunch of other different kinds of programs. They are advocates for you. They can file appeals. They help you can file claims. And we have an elder benefit specialist who works with people 60 and over, and a disability benefit specialist who works with people under 60 who are disabled. And in 2020, benefit counseling was provided to, oops, something's not right here. Benefit counseling was provided to 727 people in 2019 and 1,058 in 2020. So that was quite a significant jump in a year. And you can see what the monetary impact is. So they were pretty busy despite the pandemic, and they did everything from their homes.
And what does monetary impact mean, Lonnie?
Well, that's a good question, Chris. I think it's just with all the different programs that it's like the money that they've helped people save, I believe.
Or get.
Like, yeah.
Right. Like if I was eligible for Social Security disability and I had been experiencing conflicts of, unable to get denials of getting that, and then you were able to obtain that, help me obtain that, that would be, say, $1,000 a month. So that would be the monetary impact would be $12,000 over the year. So for each of those, for each of those two staff, they were able to procure, one of them almost $1 million and the other $2 million worth of helping people to cut the red tape to get the benefits that they were entitled to.
Thank you for explaining that. It's hard to explain. Okay, moving on to our senior nutrition program. Dunn County community members received 35,842 meals in 2019, and in 2020, they received 36,585. If you were at the nutrition meeting a little bit ago, you know that the Congregate meal sites were closed, so obviously not as many meals were served. In 2020, only 3,414 meals were served, and that was just from probably January and February last year. Otherwise, it was closed the whole year. But there were 18,716 home delivered meals to 209 people in 2019. And in 2020, we delivered 33,171 meals to 438 people. So that is huge, huge increase.
And was that all delivered by volunteers, or some of that paid folks doing it?
Well, at the beginning of the pandemic last year, we had some of the paid staff do it. We weren't sure exactly if we should have volunteers out there delivering. And then once we figured out it was relatively safe, the volunteers started again. So most of it was done by volunteers, but at first it was paid staff.
Well, pulling that many volunteers together is just really to your credit. That's great.
So there's actually two ways in which meals, there's several ways. So we have a contract, a purchase of service contract. It goes out every 5 years or so that we put it out on a bid. And there is an entity that picks the food up at the Neighbors of Dunn County and then drops it off at the meal sites. And then, sorry, I should just let Bernie speak to this because I'm going to get it wrong. Bernie, can you speak to the contracted delivery providers versus the volunteer drivers?
Yes, sure. So, yeah, right here in Menominee, excuse me, we have 3 routes daily that cover the city and just in the outskirts a little bit, but those are all volunteers that deliver those routes. And then in Colfax, we have a few volunteers that deliver in and around Colfax. However, when we start talking about the rural locations that we deliver to, so for example, O'Galley, Wheeler, Boyceville, Rock Falls, those areas are covered by the contracted drivers. There's one individual that covers the northern part of the county and another that covers the southern part of the county. So it's hard to find, of course, the volunteers are more interested in delivering in town. So that's why we have that set up where we have the paid drivers deliver. So they're driving, miles and miles each day to cover their routes.
And they help to transport the food as well, though, right? Do they pick that food up and take it when the Congregate meal sites are open? They deliver food to Colfax, correct?
You are correct. They are actually even now. So throughout this whole pandemic, one of the individuals picks up the meals from the neighbors of Dunn County and then heads over to the Menominee site at Tantera and then over to Hosford Ridge in Menominee here. And then she heads, south or west, depending on where she's going that day. And then the other individual, Mike, he picks up the meals at the neighbors of Dunn County and then heads to Colfax. And then they pack out a route for him. They do carry out, offer carry out, and then they have some individuals that deliver in town, but then he heads out. Usually he's heading west to like the Tanner Lake area, like I mentioned, Boyceville, all those rural areas. So they besides delivering, they do move the food in bulk from the neighbors of Dunn County. So, yeah.
And like I indicated, those that service goes out on a bid every 5 years or so. I don't know exactly the bid cycle, but it's usually about 5 years to see if there's anyone else interested in doing it. It's sort of passed by not word of mouth, but in a sense, kind of word of mouth or experience between kind of I own the service and then I hire someone to help me do one of the routes. And then when I don't want to do it anymore, that person picks up the route and they hire somebody else. And it's sort of moved. And it costs about, I want to say it's just under $70,000 for the year for all of that driving 5 days a week, getting the meals out and getting the food to the sites where it needs to go.
Any more questions on that? Okay, still on the nutrition program. In 2019, 4,178 hours were worked and an in-kind service valued at $102,963. In 2020, Bernie Allen, the nutrition coordinator, along with the site managers and the generous volunteers, worked a total of 2,843 hours with an in-kind service valued at $71,861. We have our volunteer driving program. In 2019, the volunteer driver program provided transportation to 44 people who are elderly or veterans, and the volunteers drove 53,705 miles and provide 1,533 hours of service. But of course, due to the pandemic in 2020, only 25 individuals were served with 14,008 miles driven and 325 hours of service provided. And that makes sense with the pandemic. I mean, no one wanted to be the driver and no one wanted to get in a car with a driver. So it makes sense. It's starting to pick up again though now.
And a lot of voluntary medical services were not occurring, at least for a good part of last spring. People weren't attending appointments as they would typically have been.
You're doing like virtual appointments and stuff. We have our caregiving services. Caregiving services are for family members, neighbors, and friends who help care for people 60 and older, or people with Alzheimer's or other sort of dementia. It provides information and counseling on reducing stress and the importance of self-care for caregivers. Lots of educational material, especially on Alzheimer's disease. And there was funding and supplies that help care for our loved ones. And that was a big thing that changed in the pandemic. We got a lot more funding to help support the caregivers. And we recently hired a new caregiver coordinator, Casey Ramsos, who plans to start getting support groups up and running again. And she has started one already and had a couple sessions, but they are done virtually. And I would say the caregiving services took the biggest hit during the pandemic because we just couldn't have, these people congregating. And we tried to do some virtual ones, but a lot of people just did not like doing the virtual, or they couldn't understand how to use the computer to do it. It's just better to be done in person. So hopefully we will get back to doing that. And I think Casey was planning on maybe starting some in-person ones, maybe held outside, like at a park, to try it that way first and see how things go. So our dementia-related services, we hired a dementia care specialist in 2020, Carla Burscheit. Again, we weren't due to the pandemic. We couldn't do a lot of the hands-on training that were done in previous years. But Carla has done a wonderful job at doing a lot of online virtual activities. She's done virtual book clubs online about dementia, a few support groups. She's gotten a lot of, she's just been really out in the community making a lot of good contacts. So hopefully she'll be able to get out there and do more hands-on, such as the dementia training, like the Dementia Live, where you can actually like experience how it feels like to have dementia. Adult protection is another service. It's services for emergency situations such as housing issues, medical crisis, and need for food or assistance with heating and energy costs. The staff provides resources to help keep vulnerable adults safely and independently in their home. The investigation and assessment of referrals alleging the abuse or neglect of vulnerable adults, including the elderly. They do guardianship proceedings and protective service of placements that might require a court order. And in 2020, there were 127 cases of elders at risk, that's 60 and over. There were 60 cases of adults at risk. A legal guardianship was petitioned for 30 vulnerable adults, and 11 new protective placements occurred. And 77 individuals resided in court-ordered protective placements.
So basically, the difference between the elders at risk and the adults at risk is the age. And elders at risk would seem fairly straightforward. Those would be persons, and we get a lot of referrals for financial abuse kinds of issues where someone is alleged to be mismanaging or misusing someone's money. That's not the only kinds of referrals, but those are predominantly a majority of those. The adults at risk are people who are under the age of 60, of the age at 18, but under the age of 60. And those would be situations, and I've given this illustration before, but I think it's a telling illustration of the kind of cases that would involve. There was many years ago, a young woman who was a young adult who lived with her mother, and the mom's boyfriend was asking the young adult woman if he could take naked pictures of her. She was not of a cognitive ability to be able to consent to that. And that was an Adult Protective Service report investigating her being vulnerable and at risk and not being able to protect herself. And so, you know, kind of whatever came out of all of that, I'm not sure, but that would be the kind of example of something who would be the difference of why we would be involved in investigation of someone who was of a younger age. And then a protective placement simply means that someone needs to be in a type of a facility. It could be a nursing home. It could be a group home, or they call it a community-based residential facility. It could be an adult family home. But it's a legal status to their placement, oftentimes occurring when there is a more at-risk situation for that individual, like they might be prone to fleeing or wandering. And a protective placement allows law enforcement. So if I'm placed at the Neighbors of Dunn County under a protective placement and I wander out the door, I mean, I hope that that wouldn't happen, but just for illustration's point, I wander out the door, law enforcement would be able to pick me up and take me back to the facility, return me to the facility. Without a protective placement, there's not a legal way of getting me back to that spot. So I'd say a lot of the protective placements are related to someone who's involuntarily or involuntarily in a placement, or because they don't see their own need for it, or they are at risk of wandering or fleeing from that facility. And every year, every single one of those 77 people who are on court-ordered protective placements, every year they have what's called a Watts review, which means that they have an attorney assigned, a social worker, they interview the person in their setting where they are currently residing. They kind of just investigate to make sure that all of the circumstances surrounding their placement are going well. And those were also an area that were pretty significantly impacted on two levels. One, that's a hearing in front of the court. That review happens in front of the court that did the protective placement, and it involves seeing people in their natural environment. So while there were not the ability for staff and or attorneys, their guardian ad litems to see them in the facilities, they needed to do that work remotely. And then the court hearings were happening remotely as well. So that was an area which probably, I mean, thankfully, I don't know that anything, not proper happened, but that would be an area where you see the direct impact of virtual work being less than what would be if you can actually have eyes on someone in the facility that they're living in and speak to them and just know that they're being cared for well.
Chris, I have a question. Do they have to have a guardianship to have the protective placement, or can a power of attorney for healthcare that's been designated, can that serve as to develop a protective placement?
I am sorry that this is one of the areas that I am weakest on. And so I am not sure. I want to say yes, but that's a good question. And let me find an answer to that, and we'll talk about it next time. As a general rule, most of them do have guardianships, but it rings as true to me that they may well be able to have a power of attorney for healthcare as well. And the reason why Lonnie can't answer these questions is because actually Adult Protective Services, it's correlated to the ADRC side of it, but the manager who oversees that actually kind of kept that when she moved to the behavioral health side of things, just because she was fluent in that. So Lonnie has not had to learn that language, but let me check on that, Margie, and see, because I'm not sure.
Okay, and I assume that the 11 protective placements that you have are part of the 77 individuals that have the court order.
Yes, those would be new ones that happened in 2020, and those would be part of the 77.
Okay.
Yes.
All right.
We don't do a ton of protective placements. We try not to. I think the philosophy around some of that has really changed, both internally, but just as well as, I mean, just to think just in the culture at large around only if absolutely sort of needed. Otherwise, you try to work either with a guardian and the individual to try to get them into a spot that everyone's agreeable and meets their needs.
Any other questions on that stuff? So looking into this year, 2021, I guess we're really hoping to get those support groups up and running again. We'd like to start doing the Dementia Live trainings, and those occurred at like churches and schools, and we did one at our building, and they're really very interesting to do. We need to start doing more memory screens, which is really hard to do on the phone or virtually. You really need to be in person for that. And we'd like to do more outreach, things like we used to do, health fairs and just going out in the community and just being more present. So those are kind of what we hope to do in 2021.
And what I would say is we've had, we did a dementia live training for the ADRC advisory committee probably 3 or 4 years back. I'm not sure which, but a while back. And I don't know that we have any carryovers of members from that. Sarah, were you part of that?
No, I don't believe I was.
Yeah, so it's quite some time ago. So we
I
could
think
look.
I was.
Were you? Okay.
Yeah, where you
Okay.
wore advice
Yep.
on your head and yeah.
Yep.
Mhm.
It seemed like it was 3 or 4 years. I mean, maybe
Yeah.
3.
No, and so we could look at when things are a little bit more open, we could look at redoing that for a meeting as well. It's an interesting experience of just, I mean,
Yeah.
it's not perfect. It's a simulation. But I think just that whole idea about how you do things as you lose potentially your sight, your hearing, your sense of touch, some of those things, your mobility, some of those things, and try to button your shirt with gloves on.
Okay. Next on my list, we have reopening for walk-ins and planning on that. What we plan to do once the doors open for the county, our INA workers, our access workers, they're going to have to be in the office for sure to take walk-in calls.
Mhm.
And we'd like to try to start doing more home visits, but I'm not sure when that will start. When our INA workers, they do their functional screenings, and it's usually like a couple hours in the home. So they've been trying to do it all virtually and over the phone, which takes like extra long. So we're hoping maybe we can do kind of a hybrid. They can try to get the easier questions that can be done over the phone done, and then just do like a quick visit, maybe a 15-20 minute visit, just so they can actually see the person and get a better idea of how they maybe walk around or transfer. Otherwise, it'll just, whether or not we're all in the office will just depend on what Chris decides. Let's see, our aging plan update. Bernie and I have been working on our aging plan. It's a 3-year aging plan that is for 2022 to 2024. And last time, I believe we talked about the survey, and I know some of you were able to get the surveys out to people. We got 214 surveys returned, and there was just a variety of responses, all from social isolation, food, transportation. There's just a whole range of different things that people are interested in. So Bernie and I have to come up with goals, and these goals have to be very specific as to what the state wants. For example, one goal has to have something to do with racial equity. So one of the goals that we're working on is bringing back the Hmong group. And having like it was like a meal site for the Hmong people. And they would also get together and do activities. So that was one of the goals that we're hoping to get going. But there's a whole bunch of other goals that we're starting to work on. And once we kind of finalize those, we will bring those to this group. And so you guys are aware of the goals.
So just by way of background, for those of you that were new, prior to the pandemic, we had worked with some folks from the Hmong community here, largely facilitated by Frontal Lore, who worked for a long time at the job center, and with whom we had a good working relationship because of his work with the job center, and our economic support division used to be co-located there. So people knew Franta well. Franta worked with some folks in his contacts and connections, and they put together the Hmong Friendship Center, and they would meet once a month, I believe, and they would spend a significant part of the day together. They would coordinate some activities, some crafting, some cultural connection kinds of activities. And then they would also have a meal that would be, again, traditional Hmong food instead of our standard American fare for the Meals on Wheels piece. That was very successful. They were moving along, and they would use our facility in the basement, and they would meet, and they had a good representation of people. But then obviously that kind of came to a screeching halt with COVID. So the goal would be to try to reinstitute that, because it was well received and was a really nice partnership.
Some of the other goals will revolve around support groups, advocacy, health promotion, education, things like that.
And Lonnie, when is that due? When is the final due of the aging plan?
By the end of the year.
Okay.
We have to get our goals approved, and then that's just a small part of this plan. Then we have to write, I don't know what they call it, the context of it, like the statistics of the county, yeah, it's a big project.
And then that will come to this committee in
Yes.
the fall for approval, correct?
Yes. The state has to approve our goals and stuff first, I think.
Yes.
This is Margie, is there any discussion at all about developing a day program for people with dementia? I mean, I know Lonnie and we've talked about it, and I know things went haywire when COVID happened, but I know that Donna was still thinking about trying to get something going at the senior center. And I guess I'd like to just put the bug in. I know of at least 5 people that have since gone into nursing homes that really wanted a day program, and maybe only a couple days a week, but wanted some kind of day program so that they would have some respite, and the people with the dementia would have a place that they could go where it was safe and it was appropriate for their care. So anyway, I just like to put the bug out there that I still think that it's very much needed in this community, and would like to see it as a goal toward working towards something. And I know there's funding available if people take the initiative to apply for it.
And that's something I could talk to our dementia care specialist about.
Okay.
And you know, Margie, that we're going to open our adult day services back up probably July 1. So, you know,
Okay.
that's an option.
And Sherry, that would be, because I know Margie was a little late coming in. Sherry, do you know Margie?
Yeah,
Oh,
we
I
know. each
do.
other.
Okay,
Oh,
all
and
right, so I
sorry,
don't have to
I had-
introduce you.
I'm sorry I had to step away so much. I'm filling in as the acting director here at the center while our director is out. She had open heart surgery. So I just had something I had to deal with. So I'm back now. Sorry.
Well, I think Donna or Sherry, I know that if the day services program opens up, it may, I know that it may be appropriate, but it may not be appropriate for people with dementia. So that's something that's,
It depends on the stage of it. We have had people here with dementia. So, you know, I think it depends on how far into that they are.
and it depends on how they approach it. Yeah, it depends on the person. Okay, anyway, I just wanted to put that bug out there.
And you know that we are trying to actually start up a dementia
Right.
adult day services as well. We're in the process of that.
Right,
Mhm.
okay.
A few other quick updates. You know, we started that Caring Calls program where we had volunteers in the community call seniors just to chat and just to kind of help with the social isolation. We have 9 people who are still receiving calls, and those 9 have been pretty successful. There's been a lot of positive comments about it. I've called all the volunteers recently to ask how things are going, and they said it's just wonderful. One volunteer and her person that she calls, they decided to start meeting for lunch, so they've been going out for lunch once a month. They've just made a really good connection, so we'll continue it. So if you know of anybody who wants to receive calls, because I have plenty of volunteers who are willing to make the calls, but we need the people who want to receive them. We still are doing our Chromebook loan program. We got that during the pandemic to loan Chromebooks out so that support group people could maybe join support groups. So we still have those. If you know of anybody who needs a Chromebook, they can borrow one from us. And we have recently done a TV commercial, and we went in with a couple other counties, local neighboring counties, to do a commercial promoting getting vaccines at your local health department or doctor's appointment. So that should be airing soon.
I was going to try to quick find it and give you a preview.
You might have it on mine too.
Yeah, see if you can find it really quick, Lonnie, while I send me the link, and then I will I'll bring it up before the end of the meeting if I've got it. Are you done with your part? Sorry.
Yeah.
Okay. Sherry, did you have a question?
I did. You know, Lonnie said something about looking for people who would like to get a phone call. I could put something in our June newsletter, you know, referring them to your number if you would like.
And I think Donna did that a couple months ago when we first started. So yeah, I bet you could do it again. So
Disability and struggling to get you or a loved one a COVID vaccine.
I hear the commercial.
it's the commercial. Shoot, sorry. Yeah. So anyways, I can send you, Sherry, the information about that Caring Calls program if you want to put it in the newsletter again.
Okay, and that will be at the assistant@wwt.net email.
That's where you want me to send it to?
Please.
I think when we did it before, we printed off all the copies and dropped them off at the scene.
Oh, that'd be great.
Yeah, so then you didn't have
You
to.
know that we have our newsletter goes out to, I don't know, between 800 and 900 people, homes. Okay.
Yep.
Okay, that would be great.
All right. And our last order of business, if unless Lonnie's able to find can send me the link. Our last order of business is that so going forward, the county's plan for these types of meetings, all of the committee and board meetings, is to offer essentially a hybrid format. So we will host meetings in the basement of this government center building. If you've ever been in the large auditorium kind of room where the county board meeting is, it's in the room right next to that, room 60. And we will have an opportunity for you to appear there in person and be a part of the meeting in person. And then we will also, for people who aren't comfortable with meeting in person, or maybe we've had, especially this committee where a lot of folks are retired, we've had people who have gone on extended winter vacation, winter relocation. And it would be an opportunity for those persons to not miss the meeting if they were able to come in remotely, or if you weren't feeling particularly well, but didn't want to expose someone else to your germs, but wanted to hear the content of the meeting. So we will have an opportunity we will send out a link. We know how well that worked today, but we'll work on that. We'll send out a link to attend the meeting virtually, but you will also be able to attend in person, and then we will coordinate that to make that work for both sides. So that will be the plan going forward, starting with our July meeting. And the July meeting, thankfully, is not a Nutrition Advisory Council meeting in conjunction with this meeting. So, but there will be less confusion, hopefully, as we go forward. Lonnie, did you find? Oh, go ahead. Sorry, Sarah.
Well, when you left, we were at the thing of public comment, and Lonnie thought you may have had a public comment. Did you?
No, I did not. Nope.
Okay. Thank you. I thought I'd just go backtrack to that just in case.
Thanks.
So what's the date of that meeting in July?
Yeah.
July 19th.
19.
July 19th at 1 o'clock or 1:15?
1 o'clock. They'll either be at 1 o'clock when it is when it's just the ADRC Advisory Committee, and it will be at 1:15 if there, or 1:15-ish, depending on the amount of content, but if there is a Nutrition Advisory Council. And if I can't figure that out better, we might have to rethink how to do that, but I'm going to make my most concerted effort to do it well the next time.
Well, just sending it out one time is helpful.
Right,
Rather
exactly.
than multiple times.
Yes, no, and well, what happened was, there's some people that are on one committee and some people that are carry over to the second committee, and I didn't think about sending one link, but then there's complications with that because then you think you have to be there for 1 o'clock, and anyway. But the long story short is, I hope I can figure it out. Lonnie, how'd you do over there?
I can see it, but if I could share my screen, I think I could be able to just do it.
Oh, sure, we can give you permission. So,
okay, share screen.
Where are you? Oh, sorry, Randy's got to do that. Randy, can you give Lonnie permission to share her screen?
Lonnie is still a co-host.
Oh,
Okay, so you should be able to share your screen.
okay, I can try again. I don't know how I did it last time, but
Click share screen on the bottom. Make sure you check the share sound as well. There's a little box that's on the bottom left-hand side that says share sound.
okay, I think I got it. Okay, here we go.
If you're 60 years or older, have a disability, and struggling to get you or a loved one a COVID vaccine, contact your local ADRC for help. There's one in every county. We'll assist you in finding a location, signing up, deciding which vaccine is right for you, and talk to one of our trained specialists with any other concerns you have. The COVID vaccine is free, Get all the information you need with your local county's Aging and Disability Resource Center, ADRC. Call or visit our website today.
All right.
Cool.
So hopefully it's not only just some publicity with regard to vaccinations, but also a little bit of ADRC publicity to get the word out that we exist.
Is there anything else, Chris?
That is all that I have, or we have.
Does anyone have any comments or questions? Then if not, I think we can adjourn the meeting. All in favor? I don't know if you have to even do that, but
You do not have to do
let's
that.
adjourn the meeting. And thank you all for coming. And it's nice to see some new faces. So,
Bye all.
bye.
Okay. Bye-bye.
Bye.